How hard is hard enough? Hi, I'm Dr. Abraham Morgentaler, and I'm here with my wife.
Usually say your lovely wife or your beautiful wife.
I'm here with my lovely, beautiful, and talented wife.
Hi, I'm Dr. Marianne Brandon, and we are the sex doctors.
The sex doctors, we are. So I thought we would talk today a little bit about stuff that I've done over the years where guys wonder about whether they are hard enough. Mm-hmm. So, as a doctor specializing in sexual medicine, one of the most common things that we dealt with was impotence, or as it later became known, erectile dysfunction, or penis doesn't work so much. Right. Now, most of those men who come in because they feel like they've got a problem, like things aren't working that well. Mm-hmm. And it's not a mystery generally about whether or not there's a problem. But sometimes we wonder whether there's a psychological issue, or men also have the experience where they can have sex with one partner, but may not be able to have sex with another partner.
Or they can masturbate, but they can't have sex, right?
Exactly, yeah. So, the first challenge, if you will, when somebody comes in is to try and figure out whether this problem is more likely to be psychological or physical.
And psychological means like performance anxiety. When people get anxious, it's very difficult for their body to become aroused.
Exactly right.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
Welcome to the Sex Doctors, featuring Dr. Marianne Brandon, clinical psychologist and diplomate in sex therapy, and Dr. Abraham Morgentaler, renowned urologist and expert in sexual medicine and testosterone therapy. Together, they bring you expert insights into sex, intimacy, and relationships. Let's dive in.
I believe in miracles. Where from?
When I started, I came out of my training in 1988, and I was at the Beth Israel Hospital, now Beth Israel Deaconess Medical Center. And I wanted to specialize in sexuality and infertility for men. And I went to my chief and I said, I want to open up a clinic for men who have, we called it impotence then. Later, we felt like that was the wrong term. And
a negative connotation.
Hey, Ace, thanks for joining us. You're here for a discussion about erections.
He has difficulty with that since we removed his testicles.
Yeah, that's sort of a non-issue.
Yeah.
But maybe he wants to hear how the other half lives. Probably, I know. Anyway, so this was 1988, 1989, and I was given permission to start a clinic for this, but I had to do it with the psychiatry department. Why? Because the idea still back then, it's not that long ago, it's certainly we're talking about middle of my lifetime, my career, is thought that this was psychological in the vast majority of cases.
Right.
That came from the work of Masters and Johnson.
Unhelpful.
Yeah, Master Johnson considered the greatest sex researchers of all time. Right. And, what they did, and they examined all these men who they saw with erectile dysfunction. And their physical exams were normal, and and whatever blood tests they did were by and large normal. And they said, "See, guys are having trouble. We can't find the physical cause, so it must be psychological." Now the truth is, and it took us a while to figure out that in about 80% of cases, it's physical, non-mental. But back then, it was felt like this was still, Mesh and Johnson did their work in the 60s.
Yeah.
Right?
Yeah.
This is the 80s, 20 years later. Right. I knew a lot, but that was still the prevalent thinking at the time. Anyway, before too long, it became very clear that in the vast majority of cases, it was physical. And the reason Masters and Johnson didn't get it was that the physical examination is normal in most of these men. The defect is usually vascular, and there's nothing that shows up. It's just that the penis can't either deliver enough blood to the penis to get it hard, or the trapping mechanism, or the extra blood that gets there, just won't stay there. And that goes out through these, normally there are these little valves really that shut it off. And whatever blood is in there is trapped in there with very little going in and very little going out. That's a normal erection.
Yeah.
And when those don't work as well, smoking, age, diabetes, hypercholesterolemia, a million things that can affect vascular stuff, then penis stops being hard. And often what men notice when they have what we call a venous leak where the blood is leaving is they can get hard, but their erection won't last. And so we call that difficulty maintaining the erection. Yeah, they can get hard, but leaves. But psychological impotence still occurs, or ED, right? And it's just as you mentioned. And so sometimes we really need to try and figure out what's going on. So the question is, how do you do it? And then we have an added situation where we have younger guys, usually younger, who don't have that much experience and they're just worried. They've seen what people do in porn, what the male actors do in porn, and they feel deficient for all sorts of reasons. Size, performance. These guys go on the porn for 30 minutes, an hour sometimes, and the guys just feel like they don't stack up, and they may have unrealistic ideas about how hard their penis is supposed to be. Right? So if I were to ask you, Dr. Brandon, how hard does a penis need to be? What might you say?
Do you know, no one's ever asked me that question. My first reaction is I remember when I was in training as a sex therapist, they used to do a postage stamp test during the night, right?
Yeah.
I'm sure they don't do this anymore. This sounds so archaic, where they would have people, attach postage stamps to the base of their penis. And the question would be, did they get erect during the night or in the morning? And that would give you some indication as to whether or not there was an erectile issue that was physiological or.
So listen, we still did that when I was in my, DJ came out of my training. So you get a little strip of, it's like 1 cent stamps or whatever, and then you apply them.
Right.
So they're stuck together.
Yeah.
And then if they're broken in the morning, you say, well, he had an erection.
Which would say that then that would lead people to believe that, well, his physiology is working fine. It must be an emotional thing, right?
Except that it's wrong.
That's wrong.
Because just as I mentioned, some people can get hard and can't maintain it.
Right.
They're going to break that. They're going to break that postage.
The seal, the postage stamp seal.
And for a long time, we had a device called medical device. It wasn't much of a device, but it was kind of just like those postage stamps. So it actually had a little Velcro attachment to it. And then there were 3 different levels at which it could break those things. And a normal erection in theory would break all of them. But if you only broke 1 or 2, that wasn't firm enough. Now, that's erections going in terms of width. Right?
Right.
So the answer to the question, if I may say so, as to how hard does a penis need to be, the answer is it really just needs to be firm enough to do what it's supposed to do. So
depends on what you want to do, right?
Exactly, and what you want to do.
Right.
Yeah, but for a man who wants to do insertive sex, penis is going to go inside vagina if he's straight, or with a woman, and with a man, and anal sex with if he's gay. The penis needs a certain amount of rigidity.
Yeah.
Rigidity. And rigidity can be defined as the ability to withstand bending forces. Right? So it doesn't.
Which nobody, as a man, nobody wants to bend their penis. Like, I'm sure that the people are going, right?
Yeah, for sure. Yeah. So, and the other thing is that what's normal for men is different at different ages. So the erection of a normal 20-year-old is always firmer than a normal 4-year-old penis. And 40-year-old erection is better than a 60-year-old's erection, even if everything is perfect. And all 3 of those individuals, the 20, the 40, and the 60-year-old man, are all having sex without difficulty. They're all normal.
Yeah.
But the challenges can be different too. Right? So that if a 20-year-old is having sex with somebody his own age, say straight, there's often more resistance to entry. There may be better lubrication.
Yeah.
But once women start having, if they've had
I see.
vagina gets stretched.
Right.
And the resistance is less.
I see.
Yeah. And so
Many variables here.
there are a lot of variables. So how hard is hard enough? It just has to work and do it. You'd be able to place it
Wherever you want to put it, it needs to be able to go comfortably.
So I just want to talk a little bit here about how we actually determine this. I think it's interesting. Yes, may find it interesting.
He might.
So, the standard thing is we use questionnaires.
Uh-huh.
Right? So we have these questionnaires called the International Index of Erectile Function. And, the key questions are, is the penis firm enough to go inside? That's usually, and they ask it in a variety of different ways. So that's fine, except the guy already came to the office because he thinks there's a problem. Mm-hmm. Right? So if the guy's having sex, it's probably all right. Right? So there's one standard question, is the penis firm enough to enter more than half of the time?
Mm-hmm.
Yeah. So that's a sort of...
More than half of the time.
Yeah.
So that's not really that much.
Most of the time.
Okay.
Well, it's the same as more than half.
Okay.
In my office, we had something that I thought was really helpful. I kind of laugh at it, but it was so helpful. And we called it the Pillars of Hardness. And it was this little display, and it had 4 rods made out of like a plastic more rubbery kind of material. And one of them was really firm. Like it didn't give, you could try and bend it. It didn't move at all. The second had a little give. You could
so this is great. So you had the guys feel their way through these rods and say, which feels like you?
Exactly. And the last one was really almost floppy. It stood up on its own, but you could bend that any which way.
That's pretty cool.
Yeah. So that was useful for the guys to be able to show you what they thought that they had.
Yeah.
There's a questionnaire called the Erectile Hardness score that goes from 0 to 4. And, a lot of these are used in research studies. They've been shown to have good correlation and useful. Where 0 is the penis doesn't even get fatter, bigger. Mm-hmm. And 4 is completely hard, fully rigid. But again, the guys can more or less describe that too. Mm-hmm. And so the other way that we used to do things that I think is still very, very clever and useful is there's a device that measures your sleep erections. So men basically get erections when they're having sex with somebody else, when they're having sex on their own, and during sleep.
Okay.
And if the erection, and so these are standard questions we ask people, and if the erection is fully firm during any of those, it means that the plumbing and the nerves are okay.
All right.
Right?
Yeah.
So if somebody can masturbate without difficulty, the penis gets hard, but he can't do it with a partner, the explanation is
psychogenic.
Psychogenic, right? It's he's nervous. Most common thing is he's just nervous,
which is totally understandable.
Yeah.
I mean, if we put this kind of heaviness on women and said, you need to be aroused, because that's what we're talking about. We're talking about arousal. So for her, arousal is blood flow to her genitals and lubrication, right? So if we said to her, you got to be aroused, within a certain period of time of interacting with your partner, and you need to stay aroused until your partner is satisfied, but not really that much longer, because then your partner's going to be like, all right, we're done now. Like that would throw us females into a tizzy. We don't put that on women. We put that on guys. And then we say guys are so focused on their penis. But of course they are, because it's required for this kind of heterosexual interaction. Like women, if we're not aroused, we get some lube. If we want to have sex, we're good. Like it's very unfair, I think, the way this is.
You know what? You're speaking out for men. And I really appreciate that.
Well, but it's true. You know what I mean? Like I
agree with you. So listen, men have what we call performance anxiety. Mm-hmm. And then the standard response is, well, it shouldn't be a performance.
Yeah.
But there's a level at which
it actually is required. It's like,
they have to do something.
Right.
And they have to do something where getting an erection is one of the few human activities where the more you try, the worse it works.
Right. Yeah.
You have to sort of just be, there's a word you use a lot. I like it, embodied. Mm-hmm. You have to be in your body, right? And out of your head. Mm-hmm. Yeah. So there is something to that. Mm-hmm. Yeah. So there's a device that that the man takes home with him, and it's like a little gadget, and it's got 2 bands that go on around the base of the penis that encircle the penis. One at the base, one further up towards the tip, and he goes to sleep with it if he can sleep.
Is it attached to a machine? Like,
Attached to a machine.
oh, that doesn't sound very comfy.
No. But the machine's portable, right? You can put it wherever you want. But rolling over at night and all that stuff, I'm not saying it's a great night's sleep.
Yeah.
But we do want them to sleep because what we want to measure is nocturnal nighttime erection.
Yeah. Yeah.
Right?
Yeah, yeah.
And, sometimes you'll ask a guy, says, yeah, sometimes I wake up with an erection, but I don't really notice how hard it is. So this is a way of getting quantitative measurements. And what you see is, and what happens at night is that when it notices that there's enlargement, it actually tries to squeeze down a little bit, not in a way that's painful, but it measures the resistance to the squeezing.
Okay.
And that's the rigidity part.
Would that wake him up if it's starting to squeeze on his penis? Like,
It could, but it's not supposed to do it that hard. So it's called nocturnal, nighttime.
Yeah.
Penile, penis. Tumescence is the getting fat.
Yeah.
And rigidity.
Yeah.
So it measures how much larger the penis got in girth.
Uh-huh.
And its resistance, which is really rigidity, resistance that. And then the man brings it back and we get a computer printout. He does it for a couple of nights, ideally. Wow. And we get a computer printout and you can see episodes where the penis became engorged, which can go on for over an hour at a time. They usually, if they're healthy, have multiple events. It's amazing what portion of sleep is involved with an erection.
So I would assume this keeps the penis healthy, right? Because all of our body, our cells need blood. And so this is just a mechanism Mother Nature has got, like, to keep the penis healthy.
Replenish, reset.
Is that right?
Yeah, absolutely. We got to replenish get all the nutrients in there, the blood vessels. Yeah. Because during the course of a day, if somebody's busy working, he may not get a full erection.
Yeah.
At 20, he probably does here and there without wanting it. And certainly teenagers, right? But a 40-year-old man, unless he's really doing something sexual, he may not get a full erection.
So this keeps his tissues healthy.
Healthy.
Yeah, right. Makes sense.
And whether or not it's because it's healthy, the brain goes to a certain place at night and the body does certain things during sleep. So it's associated with REM sleep and deep sleep. And so there you get to see it.
Uh-huh.
And now there's a scale in terms of the rigidity that goes from 0 to 100. 100, it's not exactly clear what it's based on, but some of the healthy guys will get an erection that goes up to 100 and stays there for an hour. And other guys have different levels. Generally, we say that if it was above 50 to 60% firm, for more than 10 to 15 minutes, we say that's normal. Now, if the guy didn't sleep well, we may not see it. If he took alcohol, he drank alcohol the night before, we may not see it. But I'll tell you but I thought this thing was so useful. And what was even more useful than it having an effect on the physician was actually showing it to the man. Because it keeps afraid that he doesn't have good erections and he sees what
his printout
while he was asleep and not thinking about it.
Right.
We go, oh. And sometimes that's all that the guys need.
I get it. So then they see some proof and then they feel a little more relaxed and then the performance anxiety can kind of diminish a bit. Yeah?
Yeah. But what happens is that as men get older or start having erection problems, right, where the rigidity isn't as good, we have a lot of variability. So a 20-year-old with a perfectly firm erection, most of his erections are either all or none, like he's fully hard where there's nothing, right? But that's not true when you're 35, 45, 55. Things need to be more and more perfect for everything to work out because the level of arousal has to be right and the level of relaxation.
Yeah.
So I've seen
that's so complicated. You have to be up and down at the same time, right?
I've had cases where the man unable to have sex with his wife while he's in the city, and they go out to their country home.
And he's more relaxed.
Everything is fine. They don't have problems.
Yeah.
And you say, well, your equipment must be okay. He says, well, I still need help, when I'm in the city. So a lot of this is before once Viagra came out, we treated a lot of people with Viagra, Cialis. That solved a lot of the problems, and we have other treatments too. But that was an interesting situation where, there's these things are not black and white.
Yeah.
Right?
Right.
And so it comes back to what I asked you at the beginning. How firm does a penis need to be? It needs to be firm enough to do the job. And the expectation at 60 is different than it is at 40.
Mm-hmm. I would say firm enough to do what you want to be doing. Right?
Go. Yeah.
Yeah.
And of course, then there's the couples who have the sexual relations where there's no intromission at all. Nothing gets inserted.
Right.
And they're fine.
They're good.
They're good. Because the real thing that has to happen is this magic, I was going to say magic sauce, but that sounds too wrong. Sex is the magic sauce, but it doesn't have to involve sauce.
It doesn't have to involve food, really.
No.
Although.
No. It's what happens between two people. That's the magic.
Yeah.
Yeah. So there we go. That's erection hardness. And anything you want to say about it?
No. That was very interesting. Thank you so much for the explanation.
Thank you for listening to The Sex Doctors with Dr. Marianne Brandon and Dr. Abraham Morgentaler. Be sure to subscribe, leave a review, and tune in next time for more expert advice on sexual health and relationships.
I believe in miracles. Where you from? You sexy thing, you. I believe in miracles. Since you came along, you sexy thing.